Welcome to the Nassau County Board of County Commissioners 2024 Benefits Presentation. New hire enrollment will be held online using the PlanSource portal. If you do not make elections during your enrollment window, you will not be eligible to make any change unless you experience a qualifying life status change event. Required dependent documents must be uploaded to PlanSource and approved by the benefits team in order to add any dependents to your group plans. Before we get started, here are a few key terms to note. A deductible is a set dollar amount that a person must pay before insurance coverage for medical expenses can begin. Plan deductibles begin each calendar year on January 1st, known as a calendar year deductible or CYD. A copay is a fixed dollar amount you pay for covered health care, usually at the time you receive the service. Coinsurance is a percentage of your medical bill you share with the plan after you've paid your deductible. An out-of-pocket maximum is the maximum amount you pay each year for the deductible, coinsurance, copayments, and other healthcare expenses excluding the premium. After reaching the out-of-pocket maximum, the plan pays 100% of allowable charges for covered services the rest of that calendar year. It's important while making your benefit choices that you have a better understanding of how you can make conscious decisions to save on your healthcare expenses. Here are a few ways to help you along the way. Rather than visit a doctor's office for routine illness, you can take advantage of virtual or telephone visits. Visit an urgent care facility rather than an emergency room for non-emergent medical concerns. Use generic medications when available and are a good alternative after consulting with your doctor. Stay in-network. There's a higher cost savings when using an in-network provider. In-network providers can easily be located within each carrier's website. The following 4 medical options are available to you and your eligible dependents through Florida Blue. As we go through the 4 plans, it's important to choose an option that best fits your needs for the plan year. The first medical plan option displayed is the Blue Care 60 HMO. This plan has copays for services, and the calendar year deductible for an individual is $1,000 and $2,000 for families. The out-of-pocket maximum is $4,000 for individuals and $8,000 for family coverage. There are no out-of-network benefits with this plan. This is a buy-up option. Rates are found within your benefits guide. The second medical plan option displayed is the Blue Options 3769 PPO. This plan offers both in and out-of-network coverage for you or your enrolled dependents. While there are both in and out-of-network coverages available, the greatest cost savings is always found by staying in-network for care. This plan has copays for services, and the calendar year deductible for an individual is $1,500 and $3,000 for families. The out-of-pocket maximum is $4,500 for individuals and $7,500 for family coverage. Base medical plan options are also available to you under Florida Blue, with higher deductible and higher out-of-pocket maximums. These premiums tend to be slightly cheaper based on the tier level you elect. Again, it's important to review and understand your benefit offerings for the plan year. The third medical plan option displayed is the Blue Care 46 HMO. This plan has copays for services, and the calendar year deductible for an individual is $2,500 and $7,500 for families. The out-of-pocket maximum is $6,000 for individuals and $12,000 for family coverage. There are no out-of-network benefits with this plan. The final medical plan option displayed is the Blue Options 519293. This plan offering is a high-deductible health plan, also known as a consumer-driven health plan. This plan has a calendar year deductible for an individual of $3,000 and $6,000 for families. The out-of-pocket maximum of $5,800 for employee only and $11,600 for all other tiers of coverage. Coinsurance will begin to pick up after your calendar year deductible has been met. At that time, you are responsible for 20% of the contracted rate with your in-network providers. If you're enrolled in the high-deductible health plan, you may be eligible to contribute to a health savings plan, which we'll review in just a moment. Your pharmacy benefits are automatically added to your benefit package when you are enrolled in one of the medical plans with Florida Blue. You may purchase up to a 30-day supply of covered drugs when filling a prescription at a participating pharmacy, or have your medications mailed directly to you via the mail order pharmacy program, which offers up to a 90-day supply at a reduced cost for maintenance medications, such as those for blood pressure, thyroid, diabetes, cholesterol, and many more. If you are enrolled in the high deductible health plan, Blue Options 519293, you will have the opportunity to contribute to a health savings account, for reference HSA. This is a tax-advantaged savings account that allows you to pay for current medical, dental, or vision expenses with the option to save for future health expenses. For 2024, the annual maximum contribution into an HSA is $3,850 for individuals and $7,750 for families. Nassau County will make a contribution into your HSA twice a year. The first contribution will be on the second paycheck in January in the amount of $750 for employee-only coverage and $1,125 for employee and family coverage. The second contribution will be made on the second paycheck in July in the amount of $750 for employee-only coverage and $1,125 for employee and family coverage. For employee-only coverage, the contribution amount averages out to be $125 per month, and for all other tiers of coverage, the contribution amount averages out to be $187.50 per month. These employer contributions are included in the total maximum contribution allowed by the IRS, so please keep that in mind when you are calculating any additional contributions you would like to make into this account. In order to be eligible to participate in an HSA, you must be enrolled in an IRS-qualified high-deductible health plan. You cannot have any other health coverage, and you cannot be claimed as a dependent on someone else's tax return. If you have questions about eligibility, please contact Human Resources. In addition to medical coverage, Nassau County also offers ancillary benefits, which include dental coverage through Humana. Under the PPO plans, diagnostic and preventive services are covered at 100%. Basic services are paid at a percentage level after your deductible has been met, and major services such as a crown are covered at 50%. Orthodontia is also available for children to age 19. The best way to maximize cost savings is to use an in-network PPO dental provider. The DHMO plan, as with the medical HMO, provides in-network coverage only. Covered services are provided at varying copay levels. There is no annual maximum benefit, but you must select a primary dentist. If you do not already have a primary dentist, you can go to humana.com to find one. Please be sure the dentist you select is currently accepting new patients. When enrolling online in PlanSource, you will be required to add your provider under the DHMO. Vision benefits are offered through iMed. This benefit allows for an annual eye exam, spectacle lenses, or contact lenses every 12 months, and eyeglass frames every 24 months. In addition to your vision coverage through iMed, you are also eligible for discounts, for example, LASIK surgery and hearing aids. You may visit any eye care provider you choose, but an in-network provider will offer larger discounts. You must submit your out-of-network vision claims manually, and the plan will reimburse you up to a maximum amount per service. Being enrolled in the Florida Blue medical plans, you are eligible to participate in the Better You Strides Wellness Program. This is an easy tool to encourage a healthier lifestyle while getting rewarded for certain activities. With the Better You Strides program, you can earn up to $100 in rewards. More details on these programs and rewards can be found within the Benefits Guide for 2024. All benefit-eligible employees are provided a basic life coverage policy at no additional cost. The benefit amount is $10,000. You may also elect optional life insurance benefits for yourself, your spouse, or dependent children. Employees must elect voluntary employee coverage in order to elect spouse or child life coverage. If you are a new hire, you can elect up to the guarantee issue of $200,000 of coverage on yourself and $50,000 for your spouse without having to answer medical questions, also known as evidence of insurability or EOI. If you are a current employee and previously declined this coverage but elected during open enrollment, you will be subject to EOI. In addition, if you currently have this coverage but decide to increase it or request it over the guarantee issue, you will also be subject to EOI. The EOI form can be found as you are enrolling in the PlanSource portal on the Supplemental Life election page. Premiums will not be charged until the EOI has been approved. Nassau County offers two plans for long-term disability. One is the elimination period of 90 days and the other 180 days. This means you would have to wait either 90 or 180 days before benefits will be available. Benefits are payable for the first 24 months of disability if you are not capable of performing your current job duties. After 24 months, the benefit will offset if you are capable of earning income performing job duties other than your current job. If you are totally disabled from earning any income, the benefit may continue up to age 65. The benefit will be offset by any income you may be receiving, such as paid leave. Everyone experiences problems. Locating the right assistance can sometimes be just as confusing as the problem itself. An Employee Assistance Program, or EAP, provides a counseling resource that quickly and professionally assists you and your family members by helping to clarify, redirect, and consider helpful options. In an effort to support you during these difficult times, Nassau County provides an EAP through CorpCare at no cost to you. Contacting your EAP and speaking to your counselor is confidential, and your information will not be shared with your employer. With your EAP, help is just a phone call away. For more information, see the EAP section of the contacts page of your benefit guide. Additional voluntary benefits are available through Aflac and Colonial Life. These products will not be available on PlanSource, but you may contact their representatives directly for additional information and enrollment instructions. Contact information is located in your benefit guide. Now, let's talk through next steps. You will need to make elections on the Benefits Administration portal, PlanSource, during your new hire window. If adding a dependent or spouse to coverage, gather your dependent documents to upload. If applicable, select beneficiaries for both basic life and supplemental life coverages. Complete and submit evidence of insurability for optional life coverage. During your enrollment period, you must sign on to PlanSource to select benefits that you wish to carry. New hires become eligible for benefits on the first of the month following 60 days of employment. Benefit eligibility is determined by the minimum number of hours worked per week and is structured by division for all lines of coverage. If you choose not to enroll or miss the deadline, you will have to wait until the next open enrollment period to enroll unless you experience a qualifying life event. Notification of qualifying life events and benefit changes must be reported to Human Resources within 31 days of the event. Here are the instructions on how to enroll. Log in at benefits.plansource.com. Your username is the first initial of your first name, up to the first 6 letters of your last name and the last 4 digits of your Social Security number. For example, Taylor Williams with the last 4 Social Security number of 1234 would have a username of TWILLIA1234. Your initial password is your birth date in the YYYYMMDD format. For example, December 31st, 1974 would turn into 1974 1231. If you're having trouble remembering your password, click the Forgot Your Password or Help link just below the login form. After reviewing your benefit guide and deciding which options are the best fit for you and your family, log into PlanSource by visiting benefits.plansource.com. Follow along with the instructions outlined in your benefit guide and either elect or waive each benefit type, enrolling your dependents when applicable. This is also the time to update your demographic, dependent, and beneficiary information. Generally, your username will be the first initial of your first name, the first 6 letters of your last name, and the last 4 numbers of your Social Security number. Your default password is the date of birth in the YYYYMMDD format. If you have trouble logging in for the first time, please reach out to Human Resources. Once logged into the system, select Get Started to begin the enrollment process. The system will prompt you to review and update your information. If you do not have a copy of your benefits guide, one is located on this page, which you can download. Double-check your profile information and your family members for accuracy. If you need to make edits to this information, select the small pencil icon on the upper right corner of the screen. If you find there is incorrect information and you are unable to edit the information, please contact Human Resources. Before you begin shopping for benefits, you must complete the tax survey. This will verify if you want your benefit premiums to be deducted pre- or post-tax on your paycheck. Once that is complete, then you will begin shopping for benefits by selecting Shop Plans next to each benefit type. Choose your desired election or decline the benefit. When reviewing each plan offering, click View Plan or Compare to compare plan designs. Then select Update Cart to add the selected plan to your cart. Check your beneficiary designation for accuracy. If you need to make an edit or add a beneficiary, be sure to put the percentage you would like your beneficiary to receive in the allocation box. Click Review and Check Out in order to double-check your selections for accuracy and view your final deduction amount at the bottom of the screen. Please note your benefits will not be confirmed until you hit the Checkout button at the bottom of the screen. Once you've checked out, you will be notified of your to-do list. This is where open tasks will be housed, telling you if there are any dependent verification documents required or if you need to answer evidence of insurability questions for life insurance or disability coverage. Please note you have the ability to download, email, or print your benefits confirmation statement for your records. Thank you for your time today. If you need any additional assistance on completing your benefits enrollment, please reach out to our Human Resources team.